In the United States, human papillomavirus, or HPV, is ranked as the most common sexually transmitted infection. The purpose of this video is to educate our audience on HPV and the importance of males becoming vaccinated. Noah has recently discovered that he has genital warts. He is truly shocked by the news and immediately contacts his girlfriend, Olivia, to get to the bottom of the issue.
Hey Olivia, I just think it's funny how I tested positive for HPV. Meet me in person ASAP. As possible.
5 hours later.
Do you have anything to say for yourself?
I'm sorry, last week I met up with a guy named Chad and he must have given me HPV.
When will you learn, Olivia, that your actions have consequences?
I'm sorry, we both should have been vaccinated.
I thought the vaccine was only for women. Yeah, that's me. You're probably wondering how I ended up in this situation.
Alright, the last thing I'm talk about today is the HPV vaccine. Are you interested in getting that today?
Oh, honey, you don't need that. That's just for girls.
Yeah, man. Then she told me she got HPV from Chad. I was so pissed, dude.
Wow, dude, that's really awkward. But you're vaccinated, right?
No.
Ooh, that's really unlucky, man. But I just found this really great video the other day on HPV vaccines for men. Want to watch?
Yeah, dude, sure.
This video by the University of Iowa College of Public Health identifies the causes of why fewer men get the HPV vaccine compared to females by addressing barriers at each level of the socio-ecological framework and providing strategies and solutions to these barriers in order to ensure that men reach the same vaccination rate as females.
Lack of policy proves to be a significant barrier in the delivery of HPV vaccines to men. In recent years, recommendation for the vaccine has been targeted towards young women only, and very rarely towards men. In fact, only recently was the vaccination licensed by the FDA for men's ages 9 to 26.
Barriers at the community level can be seen through populations with limited access to healthcare providers because this is the only approved location for HPV vaccinations to be given.
Also connects to barriers on the organizational level, as many physicians and healthcare providers prefer all vaccinations to be delivered in a primary healthcare setting. However, many are beginning to recognize new strategies must be taken in order to see an increase in the uptake of the HPV vaccination, such as opening the delivery of vaccinations to pharmacies and schools. This can be difficult because while the Affordable Care Act provides full coverage for all ACIP recommended vaccines, including HPV vaccines, however, alternative locations to in-house medical settings do not always qualify for this coverage, so a barrier is created by insurance companies.
Barriers on the interpersonal level of the socio-ecological model involve the willingness of parents to vaccinate their sons based upon recommendations from physicians. States in which providers lack knowledge of the vaccine or held an unwillingness to recommend the vaccination resulted in lower rates of uptake. Research in states like this show missed opportunities for the vaccine, which could be accredited to providers' lack of knowledge or misconceptions about the vaccine.
Barriers on the interpersonal level are accredited to males' lack of awareness on the purpose and importance of the vaccine. Even in the years following the FDA's approval of the HPV vaccine, very few males had received the vaccination, and many males reported having little to no knowledge of the vaccine. The majority of men shared the belief that the vaccination was unnecessary for their lifestyle or was not necessary at all.
Regarding the policy level of the social ecological model, the FDA only recently approved the HPV vaccination for men. The most important thing the United States can do is spread the word of the vaccination to everyone possible, starting on the policy level. The National Vaccine Advisory Committee needs to release a report explaining the importance of the HPV vaccine in a primary care prevention. With policy level support, the trickle-down effect can take place in the sense that organizations and communities can begin accepting the scientific knowledge and spread this to the citizens.
In regards to the community level, only 2 places in the United States require the HPV vaccine upon entry into a certain grade within the school system. The policy level of the social ecological model should implement an action that requires all public schools in the United States to require the HPV vaccine upon entry for both boys and girls. Requiring the vaccine upon entry into a certain grade can also help with getting more boys vaccinated around the ages of 11 and 12, which supports the National Vaccine Advisory Committee's recommendation of the most effective age to receive the HPV vaccine.
One of the major issues surrounding the lack of HPV vaccinations within the organizational level of the social ecological model among men is the absence of accessibility. An effective approach would be to allow pharmacies, clinics, and schools to provide the HPV vaccine instead of just physician offices. More adolescent males can then have access to all kinds of vaccines, including the HPV vaccine.
Regarding the interpersonal level, a major issue with the lack of men that have the HPV vaccine is because most families are misinformed or not informed at all about the purpose and benefits. Although this is a major issue, it ultimately stems from the lack of recommendation from primary care physicians. Agencies from the organizational portion of the social ecological model can create specific and effective communication methods with physicians to use that are full of good evidence to support receiving the vaccine to improve the interpersonal level.
With the HPV vaccine currently on the uprise, the main lagging point is the lack of knowledge among males. Kids as young as the age of 11 are recommended to get the vaccine. This can be an issue because a lot of younger males do not know the benefits of getting vaccinated, so it's important that the community and interpersonal levels of the social ecological model begin informing young men about the vaccine at an early age.
Wow, dude, that was some heavy stuff.
Yeah, dude, a lot still needs to be done to ensure that men receive the HPV vaccine at the same rates of women.
Yeah, man. I'm gonna tell all my fraternity brothers to get vaccinated so they don't go the same thing that I did.
Good idea.
Do you know what the HPV vaccine is?
No.
Are you vaccinated with the HPV vaccine?
No.
Do you know what the HPV vaccine is?
No.
Are you vaccinated against HPV?
No.
Do you know what the HPV vaccine is?
No.
Are you vaccinated against HPV?
I might be.
Do you know what the HPV vaccine is?
Nope.
Are you vaccinated against HPV?
I don't know.
Do you know what the HPV vaccine is?
Nope.
Are you vaccinated against HPV?
I don't even know.
Do you know what the HPV vaccine is?
No.
Are you vaccinated against HPV?
I don't know.